Back with you now on Wave Listens Live. Cornerstone Wellness Center joining us here today. You know Dr. Doug Kane well. He has been with us so many times before, always sharing great advice, things you need to know. We also have Angela Dyer and Meaghan joining us as well with their expertise. Good to have you two on the show with us today.
Thank you.
Dr. Kane, let's start because we go over neuropathy so many times when you've been here and the important work you do there. But today, something a little different. We're talking metabolic syndrome. Let's just start. What is it and how would I know that it's affecting me?
So metabolic syndrome actually is a phrase that was coined in the 1950s. We didn't use it much, maybe starting into the 70s, but the last 20 years it's just been really epidemic in our society. So what metabolic syndrome is, there's a collection of 5 different diagnoses. Okay, we have a slide for that, but it's high blood pressure, increased blood sugar levels, increased triglycerides, low LDL, or excuse me, high LDL, which is the, or low LDL, which is the good, low HDL, which is the good cholesterol. I'm going to get that mixed up. There'll be emails. And then the other one is obesity. So those 5 points. And to be diagnosed with metabolic syndrome, you have to have 3 of those. Okay? So when you look at those different things right there, perfect. When you look at those 5 different points there, and if you look at the number of Americans that have 3 of those, I mean, everybody knows somebody that, that would qualify as this. So, and when you look at these different diagnoses, okay, if you have high blood pressure, how do we treat that? We have a medication. If we have high blood sugar, that's going to go into diabetes. How do we treat that? There's medications. When we're talking about triglycerides and cholesterol, there's cholesterol medication. So when you have metabolic syndrome, you end up with a handful of medications that you're going to take for the rest of your life. And eventually these will lead to side effects, and we generally have more medications for that as well. So overall, how metabolic syndrome affects people is, number one of the driving forces behind this is inflammation. Inflammation is one of the building blocks of all of our typical lifestyle issues: cardiovascular disease, cancer, diabetes, a lot of that stuff. We talk about diabetes a lot on here when we talk about neuropathy, because that is the leading cause of that. And it's very much an epidemic in our society. So if we look at some of the statistics of how this affects people, we have another graphic for that. So when we talk about diabetes, almost 20% of those under the age of 18 suffer from diabetes. Over 40% of adults, okay? When we look at how many people have at least one of those 5, 88% of the American adult population has some degree of metabolic unfitness. That means only 12 of us don't have any, 12% don't have any of those 5. So, and the one thing that just really shocks me, and it's kind of small down there in the corner, 5,082 Americans are diagnosed each day with type 2 diabetes, according to the American Diabetic Association. So, this is a broad-scale problem in our society. I'm talking about neuropathy on here a lot, and a lot of our neuropathy patients have these type of issues. You know, most people don't just have diabetes alone. They have a lot of these other cofactors, and it's a major driving force in limiting our lifespan and our quality of life. So we've got a gut health metabolic program at the office, so we can help people unwind a lot of this, change a lot of the lifestyle. And as we all know, a lot of this comes from our food. It's over-processed, it's full of a lot of chemicals, you know, shelf life extenders, anti-caking properties with that. So just lots of different things that just really aren't natural. So what we do with people and how we approach this is our gut health program is anywhere from 1 to 3 months. There's 3 different factors to that. Phase 1 would be what we call heal and seal. We've irritated our GI tract with our foods, the standard American diet, for so long. We need to take those reactive things out of the diet to give your GI tract a chance to heal and seal. So what does that look like? Well, we take the reactive things out of your diet, things like dairy, things like gluten, things like the nightshade families, which is potatoes, peppers, eggplants, tomatoes, those type of things. Nuts. We know a lot of people that have reactions to nuts and even some citrus. So we give your GI tract an opportunity to calm down and to heal. Once we get that in better shape, then we can go through a detox. So we have some proprietary nutrition that helps people's liver and kidneys detox things from the body properly, and then we go through the last phase, which is to restore and replenish, where we can give your body an opportunity. We have this very simple test that we do where you actually introduce the new food back, hold it in your mouth, and actually monitor your blood pressure. This is a 100-year-old test, but it is very, very specific to how your body reacts in terms of if it can deal with that food very well, and if it's good for you or if it's derogatory for you.
I feel like we could talk about this topic all day long. I'm somebody who is not in metabolic syndrome state, but I want to know, can I come in and get on this plan so that, because I'm eating the foods, I live in the state where we're among the highest for every single thing that you mentioned. So let's talk about, while we have time, why you brought Angela and Meaghan with us today specifically.
Absolutely. Let's go ahead and start with Meaghan first with her experiences with the program.
So I got introduced by Angela to the program. I just wasn't feeling great and I wanted to feel better, and she was talking about, well, let's try the Blueprint program, and I fully committed and decided to go for it. It was not easy, but now I feel much better. The bloat is gone, brain fog is far less, and I just generally feel like I have more energy, I sleep better. So it's helped me in a lot of ways.
We're glad you were able to go through that. And then Angela, obviously she said that she learned about this through you.
Yeah. Well, she came into the office one day and noticed some changes in me, and I just started asking questions about that. And because I'd been through the program as well, I was able to be completely transparent with her about the changes that I had made in my life and why I look different. Losing weight was just a byproduct of that. So I started around 250 pounds last year, and I changed everything down to 185. So, losing the weight was just a byproduct of doing the program and feeling better, and also quit drinking during that time. And so it makes it very easy for me to be completely transparent with patients about my experience, and then helping them through their experience with it as well. And I'm so proud of Meaghan for everything that she's done. She is so humble, but she, is a very caring nurse, mother of 3 young daughters, and wife as well. And so it's just, we talked about how those changes have helped her in her life.
Well, we appreciate you two being here, sharing those experiences, because it helps for others to hear it. And again, this is not a gimmick for weight loss. No. This is a whole lifestyle change. So, okay, Dr. Kane, to finish things off, if I'm suffering from metabolic syndrome, or even if I'm not, and I say, hey, I need some changes in my life, I'm very interested in this program, what would you like people to do?
Pick up the phone, call the number on the screen. We have our staff standing by to take your calls. We can schedule you for a free consultation. So if you suffer with GI issues, sleep issues, headache, brain fog, just generally, sick and tired of being sick and tired, that's a great place to start. If you've not been able to find answers elsewhere, it's generally what we're eating. And it's important to know, we're not counting calories, we're not weighing anything, we're not demonizing fats or carbohydrates. We're actually getting down to eating real food,
which is what so many of us need to do. Well, I thank you for being on and sharing this message, and for you guys sharing your experiences as well. And I know it helps others out there as well. Look forward to next time.
Yeah, thank you.
All right.